Assalamu alaikum. Today's video is about the bronchiectasis. But before looking into the bronchiectasis, we will first see the basic structure of airways. So let's start. The airways basically consist of the four layers, and on the innermost side is the mucosal or the epithelial layer, which is having the hair-like structures called the cilia, and these cilia continue to beat or move so that the mucus and other secretions can be pushed up through the airways so that the patient can spit it out. Also, there are goblet cells in this layer which are responsible for the production of mucus, and this mucus helps us to trap the foreign particles like the dust, bacteria, viruses, and other materials. And this layer rests on the basement membrane which is outer to it. And outer to the basement membrane is the smooth muscle matrix which helps us to maintain the lumen of airways. It can contract to reduce the lumen of airways, or it can relax to dilate the airways. And the outermost layer is the fibrocartilaginous or the fibroelastic connective tissue. The main focus here is on the smooth muscle matrix and on the mucosal layer. Now, what is bronchiectasis? It is a chronic, irreversible dilation of the bronchi and the bronchioles. Remember, it is an irreversible condition. Bronchiectasis cannot be reversed, and bronchiectasis results from the destruction of muscles and the connective tissue. The muscles which maintain the lumen of airways are destructed, which results in the permanent dilation of these airways. A person can be born with it, it is called the congenital bronchiectasis, or a person can acquire this during his lifetime. Now, what causes bronchiectasis? Bronchiectasis may be caused due to the pulmonary infections, especially the repeated lung infections like the tuberculosis, whooping cough, fungal infections, or the measles. It can also be caused by the obstruction. Because of the obstruction, the cilia cannot push up the secretions through the airways, and it cannot be removed. The mucus pools down and accumulates, providing a suitable environment for the growth of pathogens, which results in repeated lung infections. And this obstruction can be caused by the tumors, foreign bodies, or the mucus plug. The next cause is the Cottagner syndrome or the primary ciliary dyskinesia. In primary ciliary dyskinesia, the cilia are paralyzed, they do not move. This results in the reduced mucociliary function or the reduced mucociliary clearance, and this causes the mucus to pool down or accumulate and promote the growth of pathogens. Now let's move towards the pathophysiology of bronchiectasis. First, due to the etiological factors like the pulmonary infections or obstruction or the Cottagner syndrome, there is inflammatory response in the airways. There is inflammation in the airways, and this inflammation results in the overstimulation of goblet cells, which then produce excess of mucus called the hypersecretion of mucus. Also, due to this inflammation, there is epithelial injury. Since the cilia are located on this epithelial layer, with the epithelial injury, this mucociliary clearance is reduced. There is accumulation and pooling down of the mucus, and this excess mucus, this hypersecretion of mucus and the reduced mucociliary clearance results in the plugging of airways by the mucus plugs, and this results in the airway damage and causes the permanent dilation of airways called the bronchiectasis. Now, what are the clinical manifestations seen in the patients who have bronchiectasis? There are repeated lung infections due to this obstruction or due to the excess of mucus which harbors these pathogens. There may be chronic cough with lots of mucus, or due to the significant damage to the airways, there may be hemoptysis, which is the coughing up of blood with the sputum. The patient may also have dyspnea, and there may also be wheezing, which is a high pitched whistling sound which is produced when the air travels through the inflamed airways or through the airways which are full of mucus. Now, how can we diagnose bronchiectasis? The definite sign of bronchiectasis is the prolonged history of productive cough, and the sputum is continuously negative for the TB bacilli. We can use CT scan which reveals the bronchial dilation, And also we can use the lung function tests which to determine the extent of lung damage that the patient has sustained. Sputum culture helps us to identify the organisms which are causing the infection. Now the medical management. First, we can use postural drainage and chest physiotherapy to dislodge and mobilize and to remove the secretions from the airways of the patient. And we can encourage the patient for the smoking cessation because smoking increases the mucus production in the airways and it also paralyzes the cilia, reducing the mucociliary clearance. For the infection, antibiotics are used like the amoxicillin clavulanate and the ciprofloxacin. For thinning up the mucus and for its easy removal, the mucolytic agents are used, and the bronchodilators are used when there is excess of mucus in the airways and the breathing is difficult. For the patients in which the medical management fails and they continue to expectorate large amounts of sputum despite the appropriate medical treatment, the surgical management can be employed. Segmental resection is the removal of a segment of a lung because of the sustained injury due to the bronchiectasis, and we can also use lobectomy in which the whole lobe is removed, and in rare cases pneumonectomy is used in which a whole lung is removed. Now the nursing management. First, we have to encourage the patient to avoid smoking because smoking causes the oversecretion of the mucus and it paralyzes the cilia, like I already said. Performing chest physiotherapy and postural drainage to help remove the secretions from the lungs. Administering the antibiotics and other medications like the bronchodilators or the mucolytics that the physician has prescribed for the patient. And educating the patient about early signs of infections because this helps us to treat the infections in their early stage and to avoid the complications. Keep the patient adequately hydrated because staying hydrated keeps the secretions thin or it reduces the viscosity of the secretions which can then easily be removed by suctioning or by coughing. Thank you. That was all about the bronchiectasis.